Morning, and thank you for inviting me to come and talk. The Schwartz rounds journey for the North West Ambulance Service started some time ago. I was invited to take part at a seminar at Haydock. I think it was the beginning of last year. And I went across to listen to the Point of Care Foundation talking about what Schwartz rounds were and how that came about. And I felt light bulb moments going on in the back of my mind, thinking, how could this help support staff within the North West Ambulance Service? And then we had an evaluation event not long ago where I was asked if I'd come and speak at this event, and I thought to myself, yeah, it's a really good way of being able to share our journey and where we're up to. So from that meeting, though, I went back to speak to our executive nurse, who's the Director of Quality, and basically said, I've just been to this seminar, and they're talking about developing Schwartz rounds within the North West, and there's only a few NHS trusts within the North West that do it at the moment. And it seemed to be, quite popular in other areas. But I could see a potential for it. And she sat me down and turned and said, well, talk us through, because I've heard something about this before. And interestingly enough, she'd been involved some time ago in doing something very similar. And she was a case of, well, yeah, I can see the benefit of it, but we really need to look at how that's going to happen, because her understanding of it was done in an acute setting, which was where most Schwartz rounds are taking place. So I did go away and thought to myself, would it be feasible, would it be possible to have a look at what actually takes place? And for those that are familiar with it, a Schwartz round is typically a monthly meeting in which healthcare professionals consider the caring and human dimensions of their work. The approach is modelled on the idea of a medical grand round where clinical teams present a patient case, discuss its treatment plan, and have the opportunity for feedback from the audience of colleagues. Whereas in our case, it was very much about turning that round into helping effectively the care of the staff. So to let you know a little bit, we were very different, as you can imagine, as an ambulance service to being to an acute trust. And this graphic just shows very clearly about the North West. We are effectively the only NHS trust in the North West that currently covers the whole of the North West footprint. There are other larger trusts that cover different counties and 5 boroughs, and Bridgewater are two trusts that do something similar. But as you can see, we effectively cover everything that is red, yellow, and blue in there. And as you can also see that we've got a challenge where we deal with what effectively is very remote, predominantly in Cumbria and little parts of South Cheshire. Rural, sort of like Lancashire, the rest of Cheshire, and the urban, which effectively is that red bit in the middle, which is Manchester and Liverpool, in essence. I was still convinced that we could do something with Schwartz rounds within the organisation, and we knew we'd have some challenges. So we also sat down again to set up a small team about how we could take that further. And NWAS itself effectively is an interesting combination of the 3 areas. We are the second largest English ambulance service. Effectively, there's only London as a trust that's got slightly more staff and vehicles and operationalisation. Some would turn around and say that the South West geographically is larger than us, but it doesn't have as many staff. 5,400 square miles. We have rural, mountainous, beaches, canals, lakes, docks, rivers, urban, really dense urban, as in Manchester, Liverpool, motorways, airports, and train lines. We employ nearly 5,000 staff, which puts us effectively in sort of like the middle type acute sector type of, or in comparison to middle sector acute hospitals. Over 109 ambulance stations. That estate is changing rapidly as we speak. We've done a lot of work over the last few years of combining work with both the police and the fire service. And a lot of our ambulance stations are now our community fire stations, especially in Cheshire and Mersey, where we share estate with the fire service. And we've got a couple in Greater Manchester where it's with the police. We cover 3 large major footprints of Cheshire and Mersey, Greater Manchester and Cumbria and Lancashire, and we call them areas. From an operational perspective, we try to keep working within them. Although we do have standardisation in all of our policies and procedures, we do tend to work within them specific areas, and we have a head of service and a consultant paramedic in each of them 3 areas as well. We have 3 operation or emergency operations centres, which is like our emergency control centres, but we've also just added in the last few months NHS 111, which is across the way at Middlebrook, and dealing with 2 of their partners, one on the Fylde coast and one in Cheshire and Mersey. Over 1,000 vehicles are in operation for the organisation. 952,000 incident attendances with over 1 million planned patient journeys per year. 1.1 million 999 calls in the Northwest last year, and up to last year, with a 5% increase in activity, which the commissioners amongst us will actually know that's meant actually more funding towards NWAS, which has helped in one respect, but there's a national shortage of paramedics, which basically is a downside in another aspect of it. And a transient population of over 7 million, and that's basically because, again, going back to the map, that big blue part gets quite a lot of people visiting in the summer periods, and the red parts gets quite a lot of people moving in and out depending on the seasons as well. So from our perspective, it was really about setting up how could we go forward. I was convinced that it would actually help the organisation with the quality agenda. It would definitely help with staff wellbeing. We are the only ambulance trust in the country, in fact, the only ambulance trust, as I'm aware, in the UK that does Schwartz rounds. We are the first ambulance service as well to actually gain IIP Gold Award and Wellbeing Champions, which we're very proud of. And I'm convinced that taking on board Schwartz rounds actually helped us achieve a lot of them other areas. It gave the opportunity to talk in a safe environment, and I'll come back in a little while talking about sort of like how the culture has developed within the North West Ambulance Service. And the main aim, or one of the main aims that the Trust has, is to make NWAS a great place to work. We've got banners within the website that turns around and says it's a great place to live, it's a great place to work. And we are trying to attract people from around the country. As I mentioned already, we've got a national shortage of paramedics, and we're doing our best to try and bring paramedics from around the country to us. So how do we go about doing it? Well, sitting down with the Director of Quality, I said Sarah's our executive nurse. She gave us the go-ahead, and we very quickly decided that the best way to take this forward was not to have a big, large committee. So it was a very small team was put together. Both myself and Becky Martin, who is with us, went away and did the training course with Point of Care. And we came back then as facilitators, and we effectively took on board an administrator, and we kept the team very, very low-key to start off with, and did a lot of sounding out to see whether or not it would be picked up. Going back to the culture, the ambulance service, the same as every other NHS trust, is working against 3 key priorities: performance, financial constraints, and dealing with the quality. Performance has been an issue for the ambulance service nationally. There has been an issue where activity has been up. Ambulance services are having to look at their operating models to see if we can effectively leave patients outside of the A&E department in a safe way. So can we move care closer to home? Can we start to work with community and primary care? And it's effectively trying to take on board admission avoidance at A&Es, and that's across the board. So what we thought of doing together was actually going out and seeing if we could talk to managers and tell them what Schwartz was about. And it was effectively not to impact on performance. We need to make sure that it was going to be cost effective. But we sat down and we thought we could make that happen, and we approached Health Education Northwest and said that we really wanted to take this on board, and so much so that we'd already missed the opportunity for the funding that we came across, but we were really keen on taking it ahead, and we paid for it ourselves. So the licence that we took from Point of Care came from the Trust. We put a paper to the executive and the trust board to turn around and say what we think we could do from that, and very quickly we got the chief exec on board, who is really keen on looking at how this could actually change some of the conversations that were taking place within the organisation. And I said to you earlier, we're very close to being something similar to what I class as a mid-size acute. Our difficulty is our geography. And trying to run a single Schwartz round in that was always going to be difficult. And what we said to ourselves is we didn't really want to be able to turn around and say we're going to have a regular Schwartz round at one particular area, because it would effectively negate a lot of the workforce. So we knew we were going to have some challenges. We decided that we needed to publicise, but not just on the Trust intranet and the website. We sort of commissioned a poster campaign and had them made, and we sent them out to every Trust premises, effectively telling staff what Schwartz rounds were about, what we tried to achieve from them, how we could move forward with it. We also did some banners, and we put them out on stations as well to try and advertise the fact. We also were very clear that we wanted to try and keep some of the themes that we were talking about very generic. And currently we do now, for each Schwartz round, advertise with an email drop to all staff. It goes into our weekly communications bulletins, and it has a banner at the top of the intranet site, so as every member of staff goes on, it's a rolling banner and it gives them the information around how we're with that. The other thing we thought we would really do is listening to our mentor, who is a doctor from a northeast acute hospital. He basically said, involve your existing panel members. It's really good to get their feedback, and once they've been through that information, get them involved with the steering group. And rather than have a dedicated steering, which we have got, we've kept that small, rather than get them to do all of the information looking forward, actually get the information that the existing or the previous panel have done. So they're invited to all the next steering group meetings. They give their input, help with us, and then that actually moves on again. And we've actually got, interestingly enough, talking to other colleagues that are running Schwartz rounds, sometimes they have difficulty in finding panel members. We've got panel members who would like to come back and actually talk again at future events, which is really positive. So what we did, to introduce Schwartz rounds, I said we required a small team. Effectively was an exec member, the couple of facilitators, which we have now managed to grow, which is really positive. A facilitator, and Becky is important to all of this because she makes sure that this happens all the time. So her role is effectively to make sure that we do publicise the information around the trust as much as possible. We got trust board approval, and something that was really important from our perspective is the chief exec came to the very first round, which we actually held here at the other side of the stadium, and he opened the round and then went and sat in the audience, which was really quite powerful because everyone was expecting him to be part of the panel. And his view was, no, this is not about an executive message. This is not about the trust board trying to get something across to the organisation. He wanted to partake and participate from the audience's perspective. He welcomed all of the panel members and the facilitators and gave an opening address effectively, and then went and sat down. And that was quite interesting because we had information from members at the same sort of time at the end of the round saying, well, why did he do that? Why didn't he give opening speech? And he was quite clear that it was not meant to be an executive message. Again, if people know what Schwartz round's about, it's not about a problem-solving issue. We're not there to find a solution to a particular issue. It's really about giving an hour to staff to talk about how they feel, how they act to a particular theme. We were very clear about making key themes very generic, and some of the ones that we have used are a day I will never forget, accepting that sometimes we cannot fix everything, and what makes me proud. And the day I will never forget brought about one particular issue which was really interesting, and I had some really good feedback, was a member of our control staff talked about her experience of having to go to coroner's court, but having to go to coroner's court having made a mistake in some of the information that had been given to the coroner earlier, and then having to go back and correct that mistake. And it was really, really powerful because without doing that, it could have changed a lot. But she knew that she'd brought herself, and particularly, as she was saying herself, she was really worried about how she was going to be able to get this across. She'd sort of like given, not on purpose, but given incorrect information. And it was about the reputation of the trust and our own reputation. But interestingly enough, she finished by basically saying that, you know, senior members of the executive and senior members of the trust sat her down and said what you did was the right thing to do, and we'll pick up all the pieces afterwards. And it was really interesting that people came up to her after the panel discussion when the round had actually finished, and said that, you know, that took a lot of courage, and it was you know, it was really admirable for what she'd gone through. We talked about some clinical situations. We had obviously dealing with paediatric incidents, but interestingly, the same one, another member of staff talked about his transition from clinician to manager, and the day you never forget is going in and actually having to tell his team that they were going to do some big change and how he was going to help support them through all of that. And again, that was quite well received. Accepting that sometimes you don't fix everything, again, one of our consultant paramedics actually managed to attend on this one, and again gave his brief from that, and it was quite well received. We've tried to keep it so that we're very generic, so that we can open it up, because I think it was very easy being a one profession organisation. Predominantly our professions are paramedics. Yes, we do employ nurses within our control centres. We now have employed 111, so we are sort of moving it. But in comparison, we've got, give or take, 1,500 paramedics and an extra nearly 1,000 ambulance technicians. That's not incorporating all of the control staff in PTS. So we're predominantly a one-profession organisation. And it would be very easy to try at the beginning to make that the room was full of people in green suits. And we didn't want that as an organisation, and we didn't want that for this, because it would then negate the fact that actually it was meant to incorporate everybody from the organisation. So we have had some challenges. Again, going back to the 3 key pointers, which, you know, every manager in the every manager in the NHS is aware of. Certain managers are not over keen to release staff if it's going to have a knock-on effect on performance. We don't release staff from overall duties. What we tend to do is say to ourselves, if you are free and you come, then there is travelling expenses, and lunch or breakfast or some form of refreshment is allowed. We do like to have all of our newly qualified staff or new to the organisation attend a Schwartz round and are given time to take that on board, which is really important. We do always, or up to now, all the panels have been very mixed. So we've had managers, non-clinicians and clinicians on the panels, which has been really positive. Our biggest factor was our geography. Go back to that one again. If we did say to ourselves as an organisation we were just going to hold the Schwartz rounds at our trust headquarters, we would negate effectively all of the blue. So we made a conscious decision at the time when we set this up, is to turn around and say that at key times of pressure, so in December, which is effectively when we could argue with the current climate, we've not actually hit winter pressures yet, and we haven't, but although activity would argue differently. We don't have a Schwartz round at all in December. We just know it was going to be absolutely ridiculous to try and get staff to be able to attend, because if they are available, they want it to be actually on an ambulance. And again, at peak pressures over the summer, so we've automatically said we're probably only going to run 10 a year. And of them 10, we were going to rotate round all of the trust. So we will hold a Schwartz round in Cumbria, in Lancashire, in Manchester, in Cheshire and in Mersey, and then we continue to rotate it round. So the next one is actually planned here again, and the other conscious decision we made was to organise the Schwartz rounds on non-trust premises. So far we have used here, we've used Everton Football Club, we've used Preston North End, we've booked Haydock Races venue. We've used a hotel in Haydock. And again, because our Schwartz rounds have varied in number. Our largest has been about 96 people turn up, and our smallest one was about 25. And interesting enough, the smaller number, being more intimate, actually was more interactive, surprisingly. But we were absolutely fantastic to have a couple where we were well over 80 for a couple of them. And as I said, our first one had 96. But But the fact that we do it on non-trust premises also actually helps attract some of the clinical staff into it, because they know it's away from work. And although it's talking about work, it's a way where they can actually relax for that hour. We are very strict on the 1 hour. It is the minute the Schwartz round starts, it goes on for exactly 1 hour, and then it completes. We do allow time for networking and to finish off anything else, and that tends to generally happen. But that's also been positively received, because I think staff are aware that it is really effectively no more than a couple of hours to get to. To get to the venue, the hour for the Schwartz round, then to get back wherever they're going to be. And it's also helped, I think, the fact that we are prepared to move it around, because people in Cumbria know that if they're not going to travel down to Cheshire to go to it, but they know that a next round or the one after that will be in their area. We do open it up to everybody, so that if there's a particular theme that people want to come to, they make the effort. We open it up and use electronic application system, which is managed through Beck's at headquarters. So everybody that wants to show an interest applies to come, which gives us an idea on numbers for catering and such like, and then we just balance it a little bit closer to the time. With operational pressures, we always know that things are going to change literally the day before, so staff may well have made every good intention to come to a round and then have been pulled in to do either a change of duty or have opted to do sort of like overtime because there's particular issues that are going on. It's been pleasing that from the non-clinical side, we do have quite a wide varied number of staff. Everything from support services like our mechanics and estates teams have been there. So it's not just the HR team who are basically saying, well, this sits within our directorate, so we've got to show willing because they want to be there. So it has been quite wide and varied. We are winning over some managers. I think the culture from a lot of the managers is still around, actually, if I've got somebody in green, I don't want them sat at a mini conference, I want them to be out working and it house around. But I think the other thing it's been really useful is the new breed of paramedic that's coming in actually are thinking along these sort of lines and actually are taking on board what's actually happening within for themselves, within their own welfare, what can happen within the trust, and they do really engage. Very busy slide, sorry, but effectively it shows you what effectively is our poster on the left-hand side. On this one, it's a little bit about what it is. This is the email that goes out, spread out actually over a couple of pages. I didn't want to do it over 2 different slides. And our next one actually is, not mistaken, is how learning has influenced my practice. And we've already had quite a few applications for that one, again, going to be held here. The positives are that when we had our assessors in recently for IIP, one of the things they wanted to talk about to staff was how they feel they can interject and interact with communications within the organisation. And interestingly enough, this was brought up. So it is having a positive effect, although quite a small one at the moment. We're not giving up. We are determined to make it grow. I have had some interest from other ambulance services to come to talk to us about how they might well be able to introduce it. I think the biggest issue is always going to be around the geography. It is, without any disrespect to acute, it's a lot easier to be able to get staff to go to one site if they're already on that site. It is a lot more difficult for us, but it's not been seen as a barrier. It was basically an opportunity to how we can work differently, and I think that was the thing that's been picked up the most, is that it would have been really easy to turn around and say, yes, we're just going to take the boardroom at headquarters, and that holds 20, 30 people, perfectly comfortable. We'll put on tea, coffee and cakes, and anyone that turns up, turns up. But a fact that the chief exec and Sarah, our quality director, wanted to make this work as well has been really beneficial. And the other benefit is our chair of the trust now has come from a Manchester Mental Health Trust, and her previous trust also did this, and she's really keen on making it go forward. So again, we've got really a lot of buy-in from the senior team. The next stage for us, I've been approached by a couple of trusts who would like to do a joint Schwartz round, and one in Cumbria around accident and emergency, and interestingly enough, a mental health trust. I'm not too sure that we're quite there yet. I'd like to be a little bit more robust within our own organisation before we sit down. So I've not said no, but I've just said just gives a little bit more time to get a couple more rounds under our belt so that we can actually turn on and say we're happy with that, because I genuinely believe that that would open up quite a lot of interest. And paramedics are different. They tend to like to go to things that are that have an interesting factor behind it. So we were talking earlier about CPD. CPD from an ambulance perspective, from my perspective, is really, really good. And it's because the staff themselves like the engagement with other professions and at universities effectively for modules. If we were to hold an internal workshop on whatever it's going to be, it's a case of, well, yeah, begrudgingly go. If I need to, I have to. Mandatory along them sort of lines, statutory training tends to be all drudged through. But if you put something up on a non-trust venue and said it's going to be connecting with X, we get a multitude of people coming forward for it. So I genuinely believe it will be quite an interesting concept. We just need to work it through a little bit more. And the problem with doing it that way as well, it's only going to it's only really affect one particular area. So we need to just be a little bit careful. If we do one, we'll probably have to do, in my eyes, at least 5 to make sure that the whole region is covered. But overall, I would suggest that if you don't do it, it's something seriously worth considering. And it's not that hard to take on board. Thank you.